Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you are able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea and available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer with the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel for the Governor's Office. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everyone. Welcome back, and thanks for joining us again today. June 21st marked the 100th day that the State Emergency Operations Center has been activated for the COVID-19 pandemic response. This is the longest continuous activation in Wisconsin history, and boy, have the people at the SEOC and their many public and private partners accomplished a lot in these last 100 days. So today I want to talk a bit about those accomplishments and everything our folks at the SEOC have been working on over the past few months. In the early stages of the pandemic, the SEOC took measures to help flatten the curve and box in the virus. Preparing for outbreaks in Wisconsin was one of the first priorities of the SEOC, so they set up isolation facilities so folks could safely isolate themselves away from others. They also took early and continued action to ensure healthcare workers and facilities had the tools, resources, beds, ventilators, and other supplies they need to tackle COVID-19 and to ensure they were well equipped to care for patients. But we also had to ensure that in the event of an outbreak, we could protect the folks on the front lines by responding to COVID-19, by helping get personal protective equipment to the folks who need it the most. To date, the SEOC has distributed more than 45,000 N95 and 97,000 KN95 masks, nearly 8 million medical and surgical masks, and more than 240,000 face shields and goggles, and 521,000 medical gowns to healthcare providers. They also installed and operated the Battelle system to decontaminate and reuse N95 respirators, which have been a scarce resource in Wisconsin and across our country since we started battling this virus months ago. Increasing testing has also been a critical part of our state's response to the COVID-19 pandemic and a pillar of the Badger Bounce Back Plan. In 100 days, the SEOC took our lab capacity from the ability to perform 0 COVID-19 tests in early March to the capacity to perform 17,668 tests daily. And because of their good work, as of yesterday, we have tested 491,702 people in Wisconsin, including those at nursing homes, hospitals, clinics, and local and tribal health departments. But in order to make sure our testing efforts were meaningful, we also had to make sure that we bolstered our contact tracing to prevent folks who tested positive from exposing family members and neighbors. The SEOC used our increased testing efforts to help protect folks who might have been exposed to COVID-19 and minimize the spread of the virus. We transferred more than 300 state employees from our state agencies and hired more than 200 LTEs to conduct disease and contact investigations, and to date, we have conducted more than 9,000 disease and contact investigations to help contain the spread of COVID-19 in Wisconsin. As the SEOC moves forward, they are continuing to take steps to ensure the safe reopening of Wisconsin and to prepare for any future surges, including continuing to provide guidance and assistance to businesses and departments across the state, as well as working with the Department of Public Instruction to ensure our kids can go back to school safely this fall. As we continue to battle the COVID-19 pandemic, the SEOC remains vital in protecting the health and safety of Wisconsinites. I want to thank the many partners who have assisted with PPE distribution to collecting more than 145,000 specimens at 190 testing sites across our state. We continue to make progress in the fight against COVID-19, not only in public health, but in our economic recovery as well. We know that the COVID-19 pandemic has been hard on Wisconsinites physically, emotionally, mentally, and financially. Our administration is committed to using our federal funds from the CARES Act to help folks across our state. Some of the ways we're doing that is with our $25 million Wisconsin Rent Assistance Program, providing $3,000 directly to individuals struggling to make ends meet due to the COVID-19 pandemic. We're also providing $2,500 grants to 30,000 Wisconsin small businesses to help them get back on their feet with the We're All In It Small Business Grant Program. The Wisconsin Economic Development Corporation is accepting applications until 11:59 p.m. tonight. So get your applications in and take advantage of this program to assist with the cost of business interruptions, health and safety improvements, wages and salaries, rent, mortgages, and inventory. In addition to small businesses, we know the COVID-19 pandemic has hit farmers hard. That's why we used CARES funding to launch a $50 million Wisconsin Farm Support Program, providing direct aid payments to our farmers that keep our state and our country fed. Folks can apply for those funds by visiting the Wisconsin Department of Revenue website until June 29th. From our $15 million food security initiative to the $200 million Roots to Recovery grant program for local government to respond to their unique needs, to the $80 million investment in our K-12 schools and higher education institutions, we are making this funding work for Wisconsinites. That includes over $1 billion in funding for statewide testing, contact tracing, operations, and response because, folks, we are not out of the woods yet. So while the SEOC has done exceptional work to prevent the spread of COVID-19 in Wisconsin, we know this virus is still very present and spreading in our communities. So, folks, don't risk it. Please continue to follow best practices like wearing a mask whenever you go out, washing your hands frequently for 20 seconds, and maintain social distancing from folks who are not in your immediate household. Continue to monitor yourself for symptoms of COVID-19, and if you have any symptoms or you've recently been in a large gathering of people, please find a testing site near you and get tested. Here in Wisconsin, we look out for our neighbors, and the best way you can do that now is by taking these basic precautions to protect yourself, your family, and our communities. And with that, I'll hand it over to Secretary-designee Andrea Powell.
Thanks, Governor. Good afternoon, everyone, and thank you again for joining us today. I do want to echo the Governor's appreciation for the critical work that our statewide response has done throughout this pandemic. What they have accomplished in the first 100 days of this response has saved lives and helped make Wisconsin a safer place to be during this pandemic. In addition to those that the Governor already mentioned, another of our teams doing impressive work is our data team. As part of our commitment to transparency, they have continually been adding new pieces of information, new levels of granularity, and new ways to display our information to ensure that the data is accessible, understandable, and actionable. And today we are announcing new county and regional level data. Just as we have used data to drive our decisions at the state level, we want to make sure local leaders, businesses, and individual Wisconsinites have the tools they need to make decisions in their communities. And the more information people have about COVID-19 in their area, the better those decisions will be when it comes to the health and well-being of all of our communities. Let me take just a minute to explain. On this new dashboard, each county and region is assessed in terms of their burden of COVID-19 cases. That is the total number of cases in that area per 100,000 residents over the past 2 weeks, and in terms of their trajectory of cases, or the percent change of those cases during the past 2 weeks. These two data points are combined into a composite indicator to determine the overall activity level of COVID-19 in a county or a region. Our local and tribal health department partners and county leadership have asked us for this information to help them make decisions at the local level. The dashboard does that and also provides this information to all Wisconsinites. So we plan to expand the dashboard to include more data and additional indicators related to things like disease surveillance, healthcare capacity, public health response in the counties and regions, similar to what we've begun displaying today. So data-informed decisions are better decisions, and it is our aim to effectively support counties and regions across the state during this pandemic response. So let me give you an update on where our numbers stand today. We have 68 active labs running COVID-19 tests in Wisconsin, with our daily lab capacity at 17,759 tests. We've had 478,165 negative tests here in Wisconsin, which is an increase of 11,531 over yesterday. There are now 25,331 confirmed positive COVID cases here in Wisconsin, which is an increase of 263 cases over yesterday. And our total number of deaths have now reached 750. COVID-19 continues to spread here in Wisconsin, as the governor has said, and I encourage you to continue the best health practices that we have been talking about throughout this response. Stay home, limit your non-essential trips, practice physical distancing, wear a cloth face covering if you can. Thank you for your continued work to help stop the spread, keep yourself, your neighbors, and your communities safe from COVID-19. Now we're happy to take your questions.
And a reminder to maintain audio quality, keep phones on mute until it's time to ask your questions, and in the interest of time, please only one question per reporter. And we'll begin this afternoon with Eric Gunn from Wisconsin Examiner. Eric?
Thank you very much for this question. I know you didn't mention it, but I know today that the Office of Commissioner Insurance and the Governor's Office announced a new health insurance portal, and that is the basis for my question. It's kind of in three parts. Did you want to switch from a federal to a state ACA exchange when you took office? And if so, what prevented that? And do you see this new initiative as a substitute or alternative to that? Thank you.
Eric, can you repeat the very beginning of your question again? I'm sorry, you were breaking up.
My apologies. Earlier today, there was an announcement that came out from the Office of the Commissioner of Insurance and the Governor's Office about a new health coverage portal that was being introduced, and I was just curious about that in the context of whether that was a substitute or alternative to doing a state ACA exchange, and whether that was something that the governor would have liked to have done when he took office and was prevented from doing so.
Yeah, and that's something I was just briefly on just last night, and so I don't have the information for you, and we will certainly get that answer to you.
Thank you, Eric. Now to Jessica Van Egren from Up North News. Jessica? Jessica Van Egren? And a reminder, *6 to unmute your phones. Okay, we'll move on then to Kent Wayne Scott from WISN TV in Milwaukee. Kent?
Hi, yes. Governor, are any of you worried about a daycare crunch if we have split schools in the fall? Is that going to be a real surge and an issue?
We're always concerned about daycare. It's an exceedingly important part of all of our lives. I have young grandkids that attend, and so I have a direct interest in that. And yes, of course, if school districts decide to split different groups of kids going to school one day versus the other, that will cause daycare issues. That said, I know school districts are well aware of that. In fact, I'm sure they're thinking this through right now. So that is an option the Department of Public Instruction laid out there, but clearly local school districts will be making that decision, and frankly, one of the things that they will take into account is daycare and how that's going to work for families.
Thank you, Kent. Now to Jeremy Janine from Urban Milwaukee. Jeremy?
Governor, how much is the state prepared to spend to support the guidance from DPI on making it safe for teachers and students to go back to school?
I'm sorry, I missed the very first part of your question.
How will the funding work? With the classroom sizes, busing issues, it seems like districts like Milwaukee and certainly rural districts will need lots of state support to be able to achieve the safety with COVID-19.
Sure, and again, there are multiple options for people within the department's guidelines. Some of them did include making sure that class sizes are small enough so that they can get appropriate spacing in the schools. That may or may not mean that there is additional costs. I think there's likely to be additional costs as it relates to testing that will likely need to happen with staff members. But all that's going to be people locally. Having been there, they are trying to answer those questions now, and certainly if we provided this last week another $42 million to local school districts, and in addition to funding that schools got previously. I'm not saying that's going to cover every cost, but there will be costs involved.
Jeremy, thank you, Jeremy. Now to Addy Bink from WFRV TV in Green Bay. Addy?
Hi, thanks for taking my question. Has any guidance been given to local municipalities that are maybe seeing an increase in cases, either from DHS or from the governor's office, on what they should do to help those cases, kind of cut off and come down?
It's a great question, Addy. I think the purpose of these new tools at a local level is to help inform the decision making that now certainly predominantly resides in local communities at the local public health and the local elected level, and understanding the burden of cases and whether they're going in the right or the wrong direction is a really important piece of information to help them make those decisions, coupled with what is our bed capacity in this region, how many contact tracers do we have, what is our testing capacity. Those kinds of things will help them contextualize and understand what's going on in their community so they can make the best decisions to keep people safe and healthy in their local communities. I think from a statewide perspective, our guidance continues to be that we need to do the maximum public health interventions to keep ourselves and each other safe, which is to continue to limit our contact with other people, to practice social distancing, to wear a mask when you're out in public as much as is safe for you to do, and really keep those practices. The fewer people we are in contact with, the lower our spread will be. And so our vigilance around those things are critical. And the data that we're giving to local communities will help them understand how well they're doing it and what kinds of additional guidance and advice and decisions they need to make at the local level to have their trajectories going in the right direction moving forward.
Thank you, Addy. Now to Katie Anderson from WBAY TV in Green Bay. Katie?
Hello, thanks for taking my question. My question is about unemployment. People are still struggling to get through to the Department of Workforce Development, wondering what more is being done, and Governor Tony Evers' staff, what more is being done to help these people who've been waiting literally weeks and weeks for these unemployment payments.
Certainly the unemployment situation as it relates to our ability to respond is not where we want it. I will say that. If I was somebody that has waited and waited, I'd have extreme frustration, and I understand that. As a result of that, we have added at least 300 more employees. We've added at least, I think there's 3 call centers. And so we're making good gains on that, but because of the significant load that was done initially, we're still battling upstream, but I feel confident that we will get there. But this is not a situation that we asked for. It's a situation where the system should have been changed. The computer system should have been changed years ago, and it wasn't. And I'm not saying that that's an excuse. That has no meaning for someone that is waiting for an unemployment check. But we're doing the best we can, and we're hoping to get behind, catch up with our work in the very near future.
Thank you, Katie. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly?
Hi, Governor. I'm wondering if your administration is considering any proposals that would provide direct assistance to the people that we were just talking about who haven't received unemployment benefits, given the delay in processing their claims, whether it's additional financial assistance, or is there any consideration of direct help for those people specifically?
Well, we've done several things where people have gotten money directly, and I'll use the rent the $25 million for rental assistance is one. But yes, we always look at that. But at the end, if we essentially create an unemployment compensation program that's parallel to the federal one, we'd still have to make decisions and adjudicate different issues, just like the UI system is. And so I'm not sure that is necessarily a bona fide answer, but we continue to look at all alternatives to get money directly to people.
Thank you, Molly. Now to Todd Richmond from the Associated Press. Todd?
Hi. Just wondering if you can say who taped the call between you, Speaker Vos, and Senate Majority Leader Fitzgerald, and what discipline, if any, will they face?
Yeah, as you know, I've said this before, unknown to me, someone did record that meeting between the two legislative leaders to assist in their note-taking. Obviously, that was wrong. I've directed the staff, they know that is improper and it will never happen again. And this is obviously a personnel issue, and discipline measures are being handled internally.
Thank you, Todd. Now to Karen Parker from the County Line. Karen? Karen Parker? And a reminder, *6 to unmute your phone. Karen Parker. Okay, we'll move on then to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for taking my call. I was wondering about the National Guard COVID-19 testing stations. I know that there was an extension at the federal level for the money for that, but I was wondering how long do you expect those locations to continue to operate, and what's kind of the future of the deployment in addressing COVID-19 testing in the state? Thank you.
So a couple of us here, I think, can jump in. We're working through many of those details right now. The federal funding for Guard participation doing specimen collection in these community testing sites goes into early August. We are preparing for their presence, their participation in our response at a reduced level beyond that. We are currently very engaged with our local public health department partners as they make their plans for testing moving into the fall. We have provided, as part of our CARES Act dollars, planning money for them to be thinking through the local partnerships and other work they need to do to have a sustainable testing strategy through the fall and the end of the year. As we continue to work together in this response, the state is certainly going to continue to purchase testing supplies to help supplement the work that's going on the ground. But we, as I said on the front, Sean, we're working through details about how we will be moving forward as we anticipate reduced GARD participation once that federal money goes away. But
we're going to be asking the president to extend that.
Thank you, Sean. Now to Stephanie Hoff from West Politics. Stephanie? Stephanie
Hi,
Hoff.
good afternoon, and thank you so much for taking my call. My question is for Ryan Nilsestuen. Did you authorize the recording with GOP leaders and Governor Tony Evers?
As the governor previously said, this is an internal personnel matter, and we're going to be dealing with discipline internally and reviewing that. And, I'm confident that we've addressed this properly in terms of making sure that this was an isolated one-time incident, and it's been made clear to staff that won't occur again. And that discipline, again, we're going to be handling that internally.
Thank you, Stephanie. Now to Danny Maxwell from WKOW TV in Madison. Danny? WKOW? And we'll move on then to Scott Gerard from the Cap Times. Scott?
Thank you very much. Can you hear me?
Yes.
Yep.
Great. So the deadline for preliminary school budget approval is just a week or so away, and leaders here in Madison have talked about operating with unprecedented uncertainty given the economic challenges right now and uncertain state budget. Governor, how do you plan to work with legislative leaders to offer districts certainty in their budgets, and is there a timeline for making those decisions?
If you're referring to how the 2021 fiscal year is going to look, we are actively looking at that right now to make sure that that people that receive money from the government, from the state government, local government, school districts, and so on, are held harmless. That is our goal. So it's going to be difficult for us to guarantee anything at this point in time. We'll certainly do as quick a job as possible. We've already started the process of reviewing next year's budget to see where we can find areas to cut so that school districts will not be held or will be held harmless, as well as other municipalities. But that's an ongoing process, and it's something we've been looking at, and we're going to continue to make decisions in the very near future.
Thank you, Scott. Now to John Dorn from WLUK TV in Green Bay. John?
Hello. The school reopening guidelines suggest, I believe, no more than 10 students in a classroom at a time. But do you think school districts and communities where COVID-19 isn't as prevalent could or should reopen more, have more students in the classroom this fall than school districts in part of the state that have some or a lot of confirmed cases?
This is interesting for me, questions about the school district. The Department of Public Instruction does not make these decisions. They have laid out, frankly, a great number of options for people, and those are options, and if school districts want to do something that is not one of those options, that's where the rubber hits the road, and that's where decisions will be made. And so there's no way that the Department of Public Instruction is telling people they have to have 10 kids in a room. That's just not accurate. What is accurate is they laid out multiple options for people and decision makers at the local level to help guide their decision making. And that's what we anticipate is going to happen.
Thank you, John. Now to Abigail Kade from NBC 26 in Green Bay. Abigail?
Hi, thanks for taking my question. This is for Dr. Westergaard. I'm curious, how many total cases of Miss C have been reported to the date statewide, and have any of those children died, and if so, any cases in Northeast Wisconsin?
Sure, I can give you the number as of last week. I haven't been updated today or yesterday, but there were 14 reported to our health department that we're investigating with the assistance of CDC, and there have been no deaths reported.
Thank you, Abigail. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you for the call today. I'm just curious if anybody with DHS could speak to this, if there's any sort of a expectation or anticipation that Wisconsin might witness a surge in COVID cases like some states have been experiencing. And if something like that were to happen, what sort of steps, if any, will the state or DHS take? Thank you.
So I do think we are seeing in a few communities around the state community spread that is not linked to a specific outbreak, which suggests to us that is the result of reduced social distancing, reduced adherence to these good public health practices that we've been talking about since the beginning of the response. And so we certainly, as usual, would encourage folks to be vigilant about keeping themselves safe, practicing physical distancing, remaining home as much as you can to reduce and prevent the spread. I think we as a state have done a remarkable job at flattening the curve, at protecting ourselves and each other, and people do need to continue to remain vigilant so that we don't see community spread at a level that reduces our ability to do effective contact tracing, right? If you are in a large gathering and you can't give us the name of the 10 people you were in touch with because you don't know, you've never met them before and you just were shoulder to shoulder with them, it's going to be hard for us to wrap our arms around that outbreak in a way that helps stop the spread. And so we would encourage people to continue to do the kinds of things they have been doing to minimize outbreaks and upticks in positive cases all across the state. I think part of the dashboard, part of the data and the information that we thought was really important and that our local partners have been asking for that we released today will really help us understand that very question. Where are the counties? Where are the regions where, based on population size, the number of cases or the burden of cases is going in the wrong direction? And we'll be able to see that on a weekly basis so that as individuals think about the way they're going to interact with each other, as local jurisdictions, as business owners, et cetera, look at the information for their own area, they can think about how to be most part of preventing surges and upticks in cases as we move through the summer and into the fall.
Thank you, Mitchell. Now to Derica Williams from Fox 6 in Milwaukee. Derica?
Good afternoon. Can you hear me?
Yep.
Yes.
Wonderful. Thanks for taking my call. This is for the governor. Just a quick question. Here in the Milwaukee area and just kind of surrounding counties where we've seen some high COVID numbers, what are your thoughts on DPI suggested guidelines for blended in-person and virtual learning for the fall when it comes to, families just trying to make this work with cost of childcare, and they're already facing a financial burden, how to balance work and homeschooling, or even kind of concerns of equity and success for students?
Well, all the things that you mentioned are things that local school boards will be thinking about when they decide how they're going to open. As you know, the department issued guidelines. Guidelines are not, you do this. Actually, their guidelines suggested several different options. It could be any of them. A school district could identify any or all of those 10. It could be something that they've come up on their own. So I feel confident in those suggestions, and it gives school districts a starting place. But frankly, they've been thinking about this since when the schools were closed last winter. And so I feel I have a confidence that the school districts will be able to figure this out.
Thank you, Derica. Now to Hope Kerwin from Wisconsin Public Radio. Hope?
Hi. Dane County and Ross County officials have recently reported increasing numbers of confirmed cases among young people, particularly those in their 20s. I'm wondering if this is a trend that DHS has seen in other college towns, and if you feel like it's something that should influence the way University of Wisconsin campuses are planning for the fall.
Dr. Westergaard's been digging into this, so I'll...
Sure. Yes, we've been. Your audio was poor at the beginning. I don't know if you said La Crosse County or a different county, but the two areas in the state where we've seen noticeable upticks are Winnebago and La Crosse counties, which have higher increase in case reports and people in the 20 to 29. So those are both college towns, and what we're learning anecdotally it is younger people in the university community. So the lesson from that is not a new message, but what needs to be a focused message that social distancing is important for all of the population, all of the communities, in all settings. Even though the risk of severe disease is very heterogeneous, older adults have a much higher risk of having severe disease and requiring hospitalizations than young adults or children. But the likelihood of clusters of hotspots of community spread increasing in communities can very much be driven by young people who don't have symptoms. So when we talk about the ways that we need to operate differently in the fall with infection control, I think we're learning that we need to really focus on younger people in the community who may not perceive as much risk, but for the sake of the overall epidemic and stopping community spread, we need to make sure those messages are heard and those precautions are taken by everyone.
Thank you, Hope. Now to Sari Lesk from Milwaukee Business Journal. Sari? Milwaukee Business Journal? We'll move on then to Maddie Heim from USA Today Network, Wisconsin. Maddie?
Hi, thanks for taking this call. I'm just wondering where we're at exactly with how many contact tracers we've hired. Just curious how close we are to that 1,000 contact tracers that Dr. Westergaard had mentioned as a goal earlier.
So we have brought on board 200 LTEs at the state level to supplement the staffing increases that local public health are making themselves to meet contact tracing needs and goals. I think one of the things that you're seeing in our numbers, over the weekend, as our testing demand is a little bit reduced, and so I think the other thing we are balancing is the need for contact tracing with the amount of testing that's going on, right? It is a positive case that triggers a disease investigation and contact tracing work. And so we certainly are not interested in bringing people on board when there is not contact tracing work for them to do. So we are working very closely with local public health to make sure we're deploying our assets in the most efficient way and supplementing where it needs to be supplemented across the state, while local public health also increases their capacity to do contact tracing in their own communities.
Thank you, Maddie. Now to Marty Hobie from TMJ4 in Milwaukee. Marty?
Hi there. Thank you for taking my call. I have a question for the governor. According to the latest numbers from the DWD, 15% of unemployment claims have not been processed. And today, a group of nearly 4,000 unemployed Wisconsinites came together to demand the firing of DWD Secretary Caleb Frostman over the backlog of claims. And we wanted to hear your response to their demand.
I'm not sure how that solves the problem. Of course, I support Secretary Frostman. And at the end of the day, changing leadership isn't going to change the fact that we have a system that should have been replaced years ago, And we will continue to add staff, as much staff as possible, to make sure that we get those claims paid out. As you know, there's several 100,000 of claims that are fraudulent that we still have to go through and make that determination. And so it's hard work, but I don't want to make any excuses. It is not acceptable for us at the state level to be struggling around this issue. People should be getting their money, but we weren't. We could not have guessed that this would have been such a significant drain on our system. The only thing we do know is that that system was deemed to be unacceptable several years ago, and it was never corrected. We will continue to do the best we can to make sure that people get paid.
Thank you, Marty. Now to Mark Stevens from CBS 58 in Milwaukee. Mark?
Hi, this could be for Andrea or Dr. Westergaard. Locally here in Milwaukee County, the local officials have expressed some concern that the number of people who are getting tested at the National Guard testing sites has been falling pretty consistently. My computer just froze. I was trying to look at the statewide numbers, but do you have any concerns over the number of tests that are actually being administered and what that trend is?
So I think we have seen certainly a small decline in demand for testing in the last couple of weeks across the state, including in Milwaukee. I think we very much encourage anyone who has symptoms to get a test. Anybody who has been in close contact with a positive case should get a test. And if your physician or your local public health department recommends you get a test, you should get a test. We continue to want to make sure we're protecting vulnerable populations like those in nursing homes and our partners in the Department of Corrections there, the people in their care. And so we are continuing to make sure that we are having good access, good testing among those populations. But obviously, we don't want folks who have symptoms just because it's summer to think they don't need to get a test. If you've got symptoms, we encourage people to seek out a test and get tested and take the appropriate actions to protect yourself and the rest of the community. I don't know, Dr. Westergaard, if you have other things about testing demand you want to say?
I think the most important message is that going forward and getting closer to cold and flu season is that cold and flu symptoms should result in a COVID-19 test. Mm-hmm. And where the test happens, whether it's a community testing site or a primary care clinic or an urgent care, is likely to evolve over time. Mm-hmm. I think we're hoping with new technologies and new systems of care that testing in healthcare settings is going to become more and more common and lower barriers for everyone to get tested as part of the care that they normally receive. In fact, we think that's really important going into the fall when the overall number of people with respiratory syndromes like influenza and other respiratory viruses goes up. It's going to become more and more important that we do testing as part of routine health care, and that there still may be a role for community-based testing and drive-up testings, but there's going to be more and more need for this to become commonplace. So I think that's the important thing is connecting cold and flu symptoms with getting a test wherever the test is easiest to get for patients.
Well, and I do think that is one of the things we're seeing in Milwaukee. Our health system partners are adding more options for testing, doing their own community testing sites, their own drive-through sites, their own respiratory clinics. So as partners in this with local public health and with the state, you're seeing, as Dr. Westergaard suggesting, a diversifying of the ways that people can get tested and are increasing the opportunities for people to get tested in more traditional healthcare settings, which is going to be a really important part of a sustainable strategy moving into the fall and through the winter.
Thank you, Mark. Now to Tyler Jobe from WKBT TV in La Crosse. Tyler?
Good afternoon, everyone, and I have a question for the governor. The La Crosse County Health Department last week put us under a severe risk for COVID-19 spread, and we've got many questions from viewers on who or what can close down businesses in the county. So my question for the governor is, who has the authority to close down businesses in not only La Crosse, but the state, and why is that?
Sure. This is Brian Nilsestuen, and I can answer that question for the governor. So the County Health Department has authority to close down businesses. That was left untouched by the Wisconsin Supreme Court's decision. As you know, last month, the Supreme Court, in I would argue a slightly flawed decision, to say the least, said that the state could basically do nothing in response, and that any decisions by the state had to go through administrative rulemaking, and legislative Republicans refused to engage in that process. So right now it is on local officials to be able to make those decisions, whether it's on putting restrictions overall in the county or on making decisions on specific individual businesses. And it's up to them to decide what works best on the ground.
Thank you, Tyler. Now to Courtney Garish from Spectrum News 1. Courtney? Courtney Garish, Spectrum News. And a reminder, *6 to unmute your phone. Courtney Garish. Okay, we'll move on then to Emily Davies from WSAW-TV in Wausau. Emily?
Hi, yes, my question in regards to actually something that Tyler sort of just mentioned. We're kind of at the point where the Supreme Court decision has now been enough time where counties have an opportunity to make some of their own rules, or at least put it in front of their boards, and they're public. Here in Marathon County, I know that they did that as well, and there was a lot of backlash with some people bringing in legal opinions as well, finding that what's been put out there hasn't been legal. They've ultimately pushed it to the Wisconsin Counties Association's work group in regards to helping counties create these different rules, emergency orders, basically. And I wanted to see if DHS has had any involvement with any of this, any recommendations from public health departments reaching out to them, and what is being determined as something that can be legal, and also something that the public, I guess, can understand, because it sounds like a lot of the public does not understand what public health officers have the ability to do.
Sure. Again, this is Brian Nilsestuen. So it's important to remember, part of the challenge is the Wisconsin Supreme Court, when it issued its decision, it's not a very clear decision. One of the things that you hope for any decision, one of the main role of the Supreme Court is to provide guidance for how everybody can operate under the law. It's the role of the judiciary is to interpret the law. In its 161-page decision, the majority did not provide clear guidelines going forward, which is one of the reasons why counties have been seeking guidance and advice. Wisconsin Attorney General Josh Kaul issued a very timely and prompt Attorney General opinion on the authority of local public health officers to be able to issue these types of orders. We've worked with the Wisconsin Counties Association and others on just these very issues. But as you mentioned, there's all sorts of different factors on the ground. And that's one of the reasons in terms of local politics and dealing with a board. And that's one of the reasons why we believed a statewide approach was the best way to deal with a statewide pandemic. And it's one of the challenges that the Wisconsin Supreme Court, by not providing clarity in terms of the entirety of the law, it's created put local public health officers. They're on the front lines of fighting this disease, and now they're also on the front lines of fighting the legal battles on this. And it's a difficult problem, but we're confident and will continue to support local public health officers to make the tough decisions they need to make in order to keep us healthy and safe.
Thank you, Emily. Now to Will Cushman from WisContext. Will?
Good afternoon. I am also interested in testing demand. It does seem to have gone down a little bit lately, but I'm curious about whether you feel you have enough testing capacity to deal with what you might expect in the fall with respiratory disease season kind of getting into high gear again. And then along with that, I imagine just more testing occurring at workplaces. For instance, it sounds like there's going to be a lot of testing going on just at UW-Madison in the fall. So I believe at the beginning of this, Secretary Paul mentioned that the capacity is somewhere around 17,000 tests per day statewide. Are you satisfied with that, or where do you want it to be come this fall?
Yeah, it's a great question, and I think one of the roles we certainly have as part of the statewide response is to continue to push to expand the capacity of testing here in the state of Wisconsin, and that capacity as close to home as possible, so that our turnaround times for understanding the result of that test is as close to the time the test was taken as possible. And so we do think we need to continue to expand capacity. Right, our initial goal was 85,000 tests a week, about 12,000 tests a day. We have exceeded that goal. We are going to continue to push to increase capacity even further. To your point in your question, we think as the fall comes, as cold and flu season starts, and you can't really tell the difference between the symptoms of influenza and the symptoms of COVID-19, that there will be a natural increase in demand, and there should be, for COVID-19 testing, considering that we will need to employ the strategies of isolation and quarantine as the way we protect people from infecting others. So we absolutely agree that our testing capacity does need to continue to expand so that we can meet increased demand for tests as we get into that respiratory season here coming up in the fall and through the winter.
Thank you, Will. Now to Shelley Nelsen from the Superior Telegram. Shelley? Superior Telegram. And we'll move on to WISC TV in Madison. WISC. WISC TV in Madison. Okay, then our final question of the day belongs to Taj Mahal from WMTV NBC 15 in Madison. Tajma?
Hello, thank you for taking my question. This question is for the governor, but I'm sure any of you could actually answer it. As you know, the country is continuing to reopen. Some states are considering making face coverings mandatory, and some cities and counties actually already have. So what's your stance on that happening here in Wisconsin as we move forward?
Certainly, the science is showing us that using face masks is an important way to keep yourself safe, along with other things like social distancing and good hygiene. So we continue to encourage it. We certainly don't have the authority to mandate it. Individual counties could possibly do that, but at the end of the day, it's up to the people of Wisconsin, and Wisconsinites have really done a great job around the issue of keeping themselves safe, and so it's unlikely that counties are going to be mandating this. If they do, that's certainly a step in the right direction. But it has clearly become a political issue, and it is a science issue. It is issues that if we wear it, we're going to keep ourselves safer. But I don't anticipate that it's going to be mandated anytime soon.
Thank you, Tajma. And that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.